Hello all. In today's video, I'm going to discuss about diet for renal calculi. Every year, more than 3 million people seek treatment for symptoms related to renal calculi. Although there is a connection to genetic predisposition, the causes of kidney stones are often related to diet and lifestyle. What is a kidney stone? Renal calculi or kidney stones is also known as nephrolithiasis or urolithiasis. A kidney stone is a hard mass of minerals and salts that form crystals in the urine inside your kidneys. These crystals grow into larger masses and pass into the urinary tract. If the stone gets blocked in the ureter or bladder, it causes pain. Sometimes blood in the urine is detected, nausea and vomiting. As the stones pass down the ureter towards the bladder, they may cause frequent urination, bladder pressure, or pain in the groin. Most kidney stones are only the size of a grain of sand, but some may be large enough to fill the collection sac leading out of the kidney. There are four main types of kidney stones. First one is calcium stones. They occur in two forms, calcium oxalate and calcium phosphate. Calcium oxalate is the most common kidney stone present among the Indians. Uric acid stones form when the urine is acidic. A diet rich in purines increases uric acid in urine. Struvite stones form in infected bladders or kidneys. Cystine stones and xanthine stones are rare and they are hereditary. They are due to inborn error of metabolism. Knowing the type of stone formed helps determine treatment and prevention options. A 24-hour urine analysis will help kidney stone treatment and prevention. Modification of diet in urinary calculi. The fluid intake. All types of stones, the fluid intake should be increased. That is, drinking plenty of fluid is the best way to avoid kidney stones, as it helps in diluting the mineral constituents in urine. Aim to consume 2 to 3 liters per day of liquids. Liquids that could be consumed are fruit juices, barley water, coconut water, lime juice, etc. Lemon juice is a good citrate source which helps prevent stone forming. Drinking 100 ml of lemon juice daily is encouraged. Tea and coffee can also be included. Spread out your fluid intake during the day. Avoid sugary drinks. Choose juices that are 100% fruit juice. When you are drinking enough fluid, your urine will be nearly colorless rather than yellow in color. Next is calcium oxalate stones, the most common stones. Oxalate is naturally found in many fruits, including fruits and vegetables, nuts and seeds, grains, legumes, and even chocolate and tea. Some examples of foods that have high level of oxalates are tea and coffee, nuts like almonds, sesame seed, and nuts product like peanut butter, cocoa and chocolate, some fruits like figs, tangerines, plum, strawberry, watermelon, guava, malted milk drinks, soy products like tofu, soy milk, soy cheese, and soy ice cream. Some vegetables like capsicum, sweet potato, spinach, eggplant, tomatoes, okra, and beetroot. Limiting intake of these foods is beneficial for people who have calcium oxalate stones, which is the leading type of kidney stone. Next is eat calcium rich foods. Dietary calcium binds to oxalate in your intestines, get absorbed into the bloodstream, and is excreted by the kidneys. This lowers the oxalate concentration in the urine, so there is less chance it can bind to urinary calcium. This leads to decreased risk of kidney stones. So, include calcium-rich foods like dairy products, leafy green vegetables, fish, fish with soft bones, calcium-enriched foods such as breakfast cereals, fruit juices, rice drinks, and tofu. Include only a moderate amount of animal protein. Third is limit animal protein consumption. Include only a moderate amount of animal protein. Eating too much animal protein, such as red meat, poultry, eggs, and seafood, is linked to a higher risk of developing kidney stones. Limit salt. Salt increases the amount of calcium in your urine. Limit sodium intake to less than 2300 milligram per day. Vitamin supplements. Avoid vitamin C and vitamin D supplements or cod liver oil. Sixth is choose whole meal and whole grain foods that are rich in fiber. Eating foods high in fiber can decrease the risk of stone formation by reducing the amount of calcium and oxalate absorbed. Choose whole meal and whole grain breads, flours, cereals, pasta, biscuits, and crackers. The next dietary modification is for calcium phosphate stones. So the rich sources of phosphorus include cereals such as bajra, barley, millet, jowar, maize, ragi, oatmeal. Moderate sources of phosphorus are bengal gram, cowpea, rajma, soybean, and green gram. Almonds, cashew nuts, gingerly seeds, mustard seeds, pistachio, cumin seeds, and poppy seeds, dry fish milk powder, and milk. So try to limit the amount of these foods. Reduce sodium. Sodium is a part of salt. Sodium is present in processed foods, canned foods, packaged and fast foods. It is also present in many condiments, seasonings, and meats. So try to avoid or reduce the amount of sodium in your foods. Limit animal protein. Eating animal protein may increase the chances of developing kidney stone. Limit eating animal protein such as beef, chicken, and pork, especially organ meats, egg, fish, and shellfish, milk, cheese, and other dairy products. Replace animal protein with some of these plant-based foods that are high in protein. So all these foods are high, plant-based foods are high in protein. And instead of animal protein, you can include these foods like beans, dried peas, lentils, and peanuts, soy foods such as soy milk, soy nut butter, and tofu, nuts and nuts product, sunflower seeds. Next is uric acid stones. So people with uric acid stones should avoid purine-rich foods, decrease animal protein intake, increase fruit and vegetable intake, limit alcohol intake, and they have to lose weight if they are overweight. So these are the purine contents of some foods. Like high purine foods include organ meat such as kidney, liver, pancreas, and brain. Sweetbreads, sardines, meat extracts. All these are high purine content foods and you have to avoid them. Meat, fish, shellfish, custard apple, chiku, and alcohol. These foods contain purine in moderate amount. You have to limit the intake of these foods. Low purine foods are mushrooms, cauliflower, spinach, pulses, peas, dry beans, coffee, and tea. So these are harmless foods for person with uric acid stones, and you can include them daily in your food. Next is true white stones, that is triple phosphate stones. How does this true white stone occurs? This condition occurs mostly in women after menopause and is usually due to an infection in the urinary tract. The causative organism, bacteria, Proteus species, produces an enzyme urease which splits urea in your urine to form ammonia. This makes the urine highly alkaline, encouraging the formation of calcium, magnesium, ammonium phosphate stones. Once these stones form, they can encourage further infection, resulting in a vicious circle of rapid stone growth. A high fluid intake, low dose antibiotics, and acidification of the urine are effective. Cystic stones and xanthine stones. It is otherwise known as cystinuria or xanthinuria. These stones occur due to inborn error of metabolism in which a particular enzyme is not secreted by the body. These simple basic measures include increase fluid intake, modify your diet, reduce the intake of methionine. This is an amino acid, so reduce the intake of methionine from which cystine is formed by cutting your animal protein intake. Alkalize urine. This encourages cystine to dissolve in your urine. Monitor your urine acidity, that is by using special pH dipsticks to be sure that your urine stays alkaline. The bottom line on preventing kidney stones. Diet changes can make a big impact on the formation of kidney stones. It is the first line of defense and can be a very effective one against kidney stone formation. So, with a few dietary adjustments, we can avoid renal calculi from occurring. Drink plenty of fluids. These are the references. Thanks for watching.